Hello everyone, Brian Kaleo, Director of Dykema's DSO Industry Group. I'm sure you've probably heard me over the last year talk about artificial intelligence and diagnostic artificial intelligence and how I believe it's one of the most valuable innovations in the history of the dental industry, and in particular is just a game changer for the quality of clinical care, a game changer for the quality of individual patient care, and a game changer for increasing the revenue of your office and increasing same-store growth. But rather than hear me just talk about it today, we're going to see it firsthand in action because it's time for my regular visit to the dentist here at Dallas Dental Group. Dr. Layla Lohmann is my personal dentist, and she utilizes the Pearl Second Opinion technology, and I'm getting ready to go in there for my dentist appointment. We're going to see diagnostic artificial intelligence utilized by Pearl in action.
Hi Brian, come on in.
Hey Doc, how are you?
Hey, how are you doing?
Well, this isn't any ordinary trip to the dentist. I've got some friends with me today. I've got Erica Zaranti from Pearl Artificial Intelligence, and I've got my personal dentist, Dr. Layla Lohmann, here with me. World-class clinician, one of the best dentists in America, and is really good with difficult patients like me here today. What are we going to do here today, Doc?
Well, thanks for covering, Brian. You're an amazing lawyer and a great patient, although sometimes difficult. Yes, I will agree with that. Today we're going to be taking 4 bite wings to check how healthy your teeth are, and I'll be utilizing the latest technology I have, Pearl AI. It's a second opinion for doctors.
Well, Doc, the suspense is killing me. What did the x-rays find?
Everything looks relatively healthy, Brian. There is one area that Pearl has alerted me to verify that there's a starting of a cavity happening. Can you see that pink area?
I do see the pink area.
Okay, this is what I do after Pearl alerts me to where I need to go. I turn it off and I check and verify that it actually is a cavity forming. Can you see the gray shadow, Brian?
No, I mean, I really can't. I don't know how you can see anything in there.
Well, doctors deal with ingredients of gray, so it is actually difficult, and sometimes that can get missed whenever you don't have a technology like Pearl to alert you of something like that.
Hey, Dr. Lohmann, could you flip on tooth parts, please?
I absolutely can.
Let me make this easy for you, Brian. So, while it's obviously very difficult to read a grayscale image for most patients like yourself, it's easy to read a map like this, right?
I can see that. There's a lot of color.
Yeah, so you should feel good because Dr. Lohmann caught this very small lesion very early, and you notice that it's stuck in this white zone of this map of your teeth, right? That means lots of minimally invasive treatments are still effective at this stage, right, Dr. Lohmann?
That's right, Erica. You've got a lot of options for you, Brian. Would you like a filling?
I don't want the drill.
Well, luckily, Brian, we don't actually have to do a filling. When you can catch things in enamel, I can do minimally invasive treatment. There's actually a product I use called Curodont. Curodont regenerates and repairs enamel back to its original state. So if you continue to floss and use over-the-counter fluoride products or any fluoride toothpaste, we can keep that lesion from growing into the green zone.
That sounds good.
All right, let me go get a treatment plan for you, and I'll be right back.
Are you gonna be accepting this treatment today?
Hell yeah, I don't want another filling.
I was expecting you to say that. And the reason why is, in fact, doctors who case present, like Dr. Lohmann did with Second Opinions AI, tend to see an increase of 30% in case acceptance.
You know, that's not surprising to me, I have to say, because this is the first time from the standpoint of the patient that I've sat in this chair. This was incredibly impressive today. I mean, to see the purple spot, you know, where the lesion was, and then you see the different areas of the teeth, and you can see how deep the lesion penetrated. It was incredibly impressive and intuitive, because, you know, we're in the dental industry, we know a little something about this, but from the standpoint of a patient that doesn't and just sits there, this was incredibly easy to understand. It gave me an enormous amount of confidence in what she's doing and Dallas Dental Group is doing here. So I just think it's really impressive, and anybody that's not utilizing this technology ought to check it out. This was just an incredible experience today from the standpoint of a patient.
Being a dentist is really hard to go from treatment side to recall side, so it really allows me to focus my patient care and bedside manner on you, but it allows me and alerts me on pathologies. It not only shows me decay, but it shows me tooth measurements in colors so that it catches my eye on those colors. It shows me blue as an apical pathology instead of a gradation of gray. So it allows me to do a quick alert and check, and then I do my own clinical verification off of that, and it allows me to help you see your teeth in a way that you're educated and informed, and I don't have to convince you of it.
Of all the trips I've had to the dentist, this was about the quickest, the quickest treatment I've ever gotten, you know, going to the dentist. This has been really great to get a front row seat to all these innovative technologies, and I really appreciate it.
You're very welcome, Brian. Thanks for thinking about me, and I appreciate you